Postpartum hemorrhage family support. This is a presentation on education, safety, and support for the family of the patient suffering from postpartum hemorrhage. Postpartum hemorrhage, it is a life-threatening condition and it can be a frightening experience. This is why it's important to provide with reassurance and to communicate with the patient's family throughout each step of the care. Prior to the event, it's important to have defined the roles of each one of the team members that are going to be providing the care. Who will be in charge of informing, educating, and providing care to the family of the patient? Move to the family to another room if it is deemed necessary and it is available. Introduce yourself and provide information about your role. Also provide your contact information. Give them your extension phone number and the ability to use a call bell. As part of the education, you will provide explanations about what is postpartum hemorrhage and its causes, most commonly known as the 4 T's: tone, trauma, thrombin, or tissue retention. It's also important to inform the patients about what are the expected interventions to treat each one of these conditions, such as medications, fundal massages, manual placental extraction, balloon insertion, or even surgical interventions. At this point, it's important to know that we also need to be sure that the newborn is safe. So if the patient is accompanied by her infant in the room, we need to ask ourselves, if the baby is not with mom, then no action is needed at this point. But if the infant is sharing the room with mom, we need to understand that mom can no longer take care of her infant, and we need to be sure that he is stable and safe. So, is there a support person with mom in the room? If no, then for the safety of the infant, the care will need to be transferred to Well Baby Nursery. However, if there is a support person with the patient, we need to ask ourselves, are they able to provide care? Do they have any physical or intellectual limitations to provide the care for the newborn? Are they an adult or a minor? When the family is allowed to participate in the care of their infant, they usually thrill and enjoy it. So we need to consider what type of education we need to give to the family, such as feeding strategies, frequency, burping, breastfeeding. Is it still possible to continue breastfeeding exclusively? At this point, it will be important to involve pediatric residents and discuss this with the caregiver as well as the mom if she is available. Provide information about how to diaper and supplies for their skin care. The safety of the infant, like bulk syringe usage and safe sleep as well. It's important to notice that the family support, they are part of our patient's care. So we need to teach them what to anticipate will be happening. Provide frequent updates and inform the family at all times where the patient is going to be located. And act as a liaison between the family and other units in order to provide timely updates.